Dr. Moataz. Implant numbers and distribution. 1. Maxilla and mandible implants. 6 implants in the maxilla, 5 implants in the mandible. Can support up to 12 teeth. 2. Restoration guidelines. Typically restore up to the first molars. Restore second and third molars if there is an opposing tooth. 3. Adjusting implant numbers. Decrease if bone is insufficient. Adjust based on anatomical interferences, sinus nerve. Consider impacted teeth, especially in older patients. Increase implants to ensure fixed prosthesis if implants fail. Healing and loading considerations. For bone healing takes time. Drilling causes cell trauma. Immediate loading isn't ideal due to cell necrosis and regeneration. 5. Occlusal load issues. Immediate loading can cause cell trauma due to continuous occlusal forces. Micro movements, 50 to 150 microns, can affect implant stability. All on 4 Concept 6. Concept Overview, introduced by Paulo Malo, uses 2 straight and 2 angled implants. 7. Advantages and disadvantages. No need for bone grafts or sinus lifts. Decreases cantilever and implant numbers, reducing costs. Suitable for edentulous patients with poor bone quality. Difficult implant placement and prosthesis fabrication. Multi-unit abutments 8. Abutment angles, straight up to 15 degrees, 17 degrees angled up to 32 degrees, 30 degrees angled up to implant placement and flexure. 9. Mandibular flexure. Occurs during mouth opening, 39 to 43 millimeter flexure. Condyles move downwards, forward, and medial. Flexure can cause discomfort and restoration issues. 10. Overcoming flexure. Do not splint full arch prosthesis as one piece. Divide prosthesis in the center for better force distribution. Cantilever management 11. Managing cantilevers. Decrease cantilever length as much as possible. Consider bone quality, implant number, and patient habits. AP spread, anterior-posterior spread should be considered for cantilever length. 12. Arch form. U-shaped arches are better for implant distribution. Tapered arches can increase cantilever effects. Crown retention. Screw retained restorations. Materials: metal plus acrylic hybrid, porcelain fused to metal, porcelain fused to zirconia, monolithic zirconia, bio-HPP. Design should allow for progressive loading. 14. Advantages of different materials. Metal framework with acrylic resin is resilient and easy to adjust. Acrylic prosthesis is best for restoring both teeth and gingiva. Porcelain is better for only teeth restoration. 15. Considerations for retention. Choose cement retained for unexperienced lab technicians. Screw retained is preferred for retrievability. Final considerations. 16. Plan before implant placement. All factors should be selected in the treatment planning phase. Position implants to consider biomechanical, aesthetic, and anatomical interferences. This detailed summary